If you are turning 65 years in May 2025 or in the next few months, this video is for you. I am going to tell you what you need to do regarding Medicare that you don't want to miss. Ignoring Medicare enrollment can trigger permanent penalties and coverage gaps that could cost you thousands. So I want to teach you critical deadlines that you cannot afford to miss. And then delaying Medicare sign up could mean higher premiums for life. And I'll show you how to avoid these costly mistakes and secure your coverage without breaking the bank. And then there are hidden enrollment windows and strategies that could maximize your benefits and sidestep costly enrollment penalties. And I'm going to demystify all that process of signing up for Medicare and save you money in a minute. So let's get to it. These are the topics I'm going to talk about. If you're turning 65, what does that mean for your Social Security? If you're not yet receiving Social Security, what does that mean, and how do you pay for your Medicare premiums? If you're working, what does that factor into everything? If you're moving out of state, there's so many things that you need to consider, including disability beneficiaries and what that means for them regarding Medicare, whether you're in SSI or SSDI. If you're living abroad, that brings in some complexities as well that I'm going to address regarding Medicare. So let's jump right in and watch till the end of this video. I have amazing news about Medicare that can save you $1,100 a year, which for Medicare enrollees is such a big savings, especially given the rising cost of Medicare premiums. I am Kwame Kwade, an entrepreneur and personal finance expert. For 15 years, I've been helping seniors get the retirement benefits they deserve. We've been working on websites on Social Security, Medicare, Medicaid, food stamps, and now we've added video content. I'm also an adjunct professor. I teach finance to graduate students at one of the most prestigious universities in the United States. If you're new here, hit the like button, hit the subscribe button, because we appreciate your support. And as always, I want to know where you're watching this video from. Do me a favor, go into the comment section. Let me know your city and your state. So let's dive in. So you can enroll in Medicare starting 3 months before your 65th birthday and then 3 months after. So you have a 7-month window in order to do this. If you're already receiving Social Security benefits, you will automatically be enrolled in Medicare Part A and Part B when you turn 65. But your Part B enrollment will be deducted from your Social Security check. So you're going to get less Social Security check, which is going to reflect the Medicare Part B premiums being taken out. For most people, you get Part A free if you or your spouse have paid into Medicare for 10 years. However, your Part B premium for 2025 will be starting at $174.70 and could be higher depending on your income. Now, you have to enroll early to avoid any gaps in coverage. So, if you're currently working and you're on an employer plan and you want to avoid any gaps in service, you have to time your enrollment carefully in order to make sure that you have coverage. So, here's what it looks like. If you are turning 65 in May, then you can enroll in Medicare February, March, and April, and then June, July, and August. So that is your window. So now that is already May, you have June, July, and August, including May, to get it done. Now, if you're already receiving Social Security benefits before age 65, Medicare Part A and Part B enrollment is automatic when you turn 65. So coverage begins the first day of your birthday month. So if you're turning 65 in May and you're already receiving Social Security, you're going to get Medicare coverage starting in May 1st, 2025. Your monthly Part B premium will be deducted from your Social Security check, as I mentioned before, and you must actively enroll in additional plans if you want other services like prescription drugs and Medigap, where you get supplemental insurance, etc. Medicare Advantage plans are also available to you if you want to, because remember, traditional Medicare does not cover certain things, and you need additional coverage in order to get those things like dental and vision, etc., and prescription drugs. If you do not want to Part B, or if you don't want to enroll in Part B due to other coverage, you must return a card Medicare sent you before coverage begins in order to avoid unnecessary premiums. Now, if you're not receiving Social Security yet, You must enroll in Medicare during the initial enrollment period. You can apply by calling Social Security at 1-800-772-1213. And since you're not receiving Social Security benefits, you have to pay your Medicare Part B premiums directly. So you have to make arrangement for that to be taken out of your bank account. Even if delaying Social Security benefits, enrolling in Medicare on time prevents costly premiums, penalties, and gives you access to the health care that you need. Now, if you're still working and your employer has 20 or more employees, you can delay enrolling in Medicare Part B without penalties as long as you have group health insurance coverage. Most people enroll in premium-free Part A at age 65 since it doesn't interfere with employer coverage unless contributing to an HSA account. So even if you're getting employer benefits, healthcare benefits, it still makes sense to enroll in Part A because it doesn't affect your employer benefits. Once employment ends and employer coverage stops, you have about 8 months, which is called a special enrollment period, then to enroll in Medicare Part A and Part B without penalties. And you have to confirm with your employer insurance to make sure that they are coordinating everything so that you don't have gaps in your coverage. Now, if you're planning to retire soon, enroll in Medicare Part A and Part B during the initial enrollment period or your special enrollment period, depending on your circumstances. And if you're retiring after 65, enroll within the 8 months period after losing employer-based coverage to avoid lifetime penalties or delayed enrollment in Part B or Part D. Now, Cobra doesn't, Cobra continuation coverage does not qualify as creditable insurance under Medicare. So even if you're going to get Cobra, you still have to deal with Medicare. And if you're moving out of state, original Medicare Part A, Part B is provided nationwide, but Advantage plans, these are regional specific and location specific, and moving out of state ignores, or moving out of state triggers a special enrollment period. So if you are in an Advantage plan and you are moving out of state, that triggers an enrollment period, special one, that allows you another 8 months to be able to then change plans. So Advantage plans, you can enroll in and be able to switch states and get into the right plan that fits your needs. So that is important to note, that when you move out of state, you have something you have to do. And prescription Part D plans, standalone drug plans, may require switching based on the availability in your state. So not only do you have to deal with Advantage plans when you switch states, but then you have to also deal with Medicare Part D drug plans, and you can use a special enrollment period to do that. So make sure that if we are moving, Social Security has your updated information. You can go online and update your records, or you can call them at 1-800-772-1213. Now, when should you get Social Security benefits? As you know, you can start getting Social Security at age 62, but you get 30% less if versus when you wait till your full retirement age. And your full retirement age is age 66 and change, or 67 if you were born after 1960. That is when you get 100% of everything that you've paid into the system. Waiting beyond your full retirement age then grows your benefit by 8% a year until you reach age 70, when you're required to take your benefits, regardless of whether you want it or not. Deciding when to start depends on your personal situation, like health status, financial needs, etc. Spousal consideration also comes into effect. Now, if you're continuing to work and receiving Social Security, you need to make sure that you are paying attention to the earnings test. If you go over that, your Social Security benefits will be reduced. 2025, the earnings test, if you're under full retirement age, is $23,400. For every $2 you go over that, you lose $1 in benefits. Once you reach your full retirement age, there is no limit onto how much you can earn. Now, let's talk about spousal benefits and Medicare. Even if you don't work enough to qualify for Social Security, you may be eligible for spousal benefits based on your spouse's earnings record. This is often 50% of the primary workers' insurance. And you can file in suspend strategy, which was something that was, available before. That loophole has been closed. Instead, both partners need to coordinate carefully when you're doing that if you're taking spousal benefits into consideration. If your spouse passes away, survival benefits can be claimed as early at age 60, providing critical income replacement and financial stability during grief and adjustment periods. Understanding your combined retirement portfolio before deciding to collect Social Security is important because there are tax consequences that you need to consider. So consult a professional financial advisor who can look at your picture, you and your spouse, and figure out when it's optimum for either of you to claim benefits. Let's talk about SSDI. When you reach full retirement age, your Social Security disability insurance benefits automatically convert to Social Security retirement benefits. There is no need to reapply or take any action. The amount you receive monthly remains the same after the conversion, ensuring a seamless transition. However, future cost of living adjustment may affect your amount. If you've been receiving SSDI for 24 months, you're automatically enrolled in Medicare Part A and Part B. This typically happens before age 65, providing continuous coverage. Because you've been receiving SSDI, you've already met the work credit for Social Security because that is one of the criteria. And so it makes everything easy to transition out of. Now, SSI is a different story. Supplemental Security Income is a need-based program. Unlike Social Security retirement benefits, which are based on work history, eligibility continues as long as you meet income and resource limits. SSI does not automatically convert to Social Security retirement benefits at age 65. Your eligibility for SSI continues to be determined by your financial situation. You may be eligible for both SSI and Social Security retirement if you have worked or you have enough work history. So apply for Social Security if you qualify for a higher amount. Remember that SSI has strict resource limits, 2,000 for individuals, 3,000 for a couple. Make sure assets do not exceed these amounts or you may risk your benefits being reduced or suspended altogether. And if you're living abroad, Medicare generally doesn't cover healthcare services that you receive outside the United States. With limited exceptions, this means you typically can't use your Medicare when you're living abroad. If you plan to return to the United States permanently in the future, you may want to enroll in Medicare Part A if you're eligible to avoid potential delays when you return. So it's good that you just have your Medicare Part A already there if you plan to return to the United States permanently. That way, when you come, you have your Part A that you can use while you enroll in Part B. Enrolling in Part B requires paying monthly premiums, so it may not be cost effective while you are away. If you're living abroad and not using Part B, it doesn't make sense to enroll in it. However, it can lead to permanent penalties if you enroll later. Research healthcare providers options in your country of residence because you have to purchase, or you most likely have to purchase insurance in the country that you are in order to get healthcare coverage. And you can usually receive Social Security retirement benefits while living abroad, but there are some country specific restrictions. Check the Social Security Administration for details. Social Security benefits can generally be direct deposited into foreign bank accounts. Ensure that your foreign bank, is able to transact with U.S. And apply and comply with U.S. regulations. Your Social Security benefits may be subject to taxes, U.S. taxes, regardless of where you live. Understand your tax obligations when you file necessary IRS returns, and keep the Social Security Administration informed of your current address and any changes to your banking information to ensure that your benefits are uninterrupted. And if you have limited digital access, there are groups that can help you. The AARP have programs, senior aging centers, senior centers, all have resources that can help you navigate signing up for Medicare and Social Security online. And if you have cognitive impairment, there are services that can help you, or you can have your loved ones help them provide services for you that can help you sign up for benefits. And if you know somebody that is in your family that is cognitive impaired but need to enroll, then you can take on that responsibility to help them find resources that can help them get the benefits they have earned. Let's talk about Medicare. I mentioned that if you're turning 65, you could save a ton of money. And there's a lot of changes that happen every year that, remember, there's 24,000 Medicare plans out there. Trying to choose the plan that is best for you in your state and making sure that the plan is still available in your state can be daunting. And it causes a lot of issues, like here in Minnesota, where seniors now have to think about whether to stick with their doctors or their health plan. How do you navigate 24,000 plans? That is why 90% of all seniors are in the wrong Medicare plan. Figuring out the plan that is right for your budget, your coverage you need, the doctor network you need to be in, the drugs that you need to be able to have covered can be costly. And if you pick the wrong plan, it can cost you money and affect your health. So we have an amazing partner that we have that can help you sort through all of this. The Trump administration recently sued Medicare advisory companies because they've been misleading seniors. Our partnership with Chapter is different because Chapter, their whole mission is to be transparent and make sure that you understand Medicare. They want to make Medicare simple so they can understand it, choose the best plan for you, and help you maximize your benefits. And it happens because one of their co-founders had a personal experience. He watched his parents struggle to navigate the process of choosing a Medicare plan, winding up paying premiums that are sorry, hundreds of dollars each month, more than they have to have paid. He realized what a terrible experience this whole process was and decided to do something about it. Another one of their co-founders actually wrote a book on Medicare. It's called It's Not Complicated. When he first started his job as a Medicare advisor, he recognized or discovered that many Americans were getting misled into buying the wrong plans simply because no one took the time to sit them down and explain what's going on. This is what Chapter is about. There are three reasons why we are partnering with them. Number one, they are the only advisory company with access to all 24,000 Medicare plans. Number two, they don't pay their licensed agents and incentivize them to push specific plan. They are not being paid to push specific plans to you. They are being paid to be your advocate. They are not advocating for the insurance company. They're advocating for you. And it can save you $1,100 a year. And when you call Chapter, you're going to be speaking with real humans. These are their licensed agents. I pulled some of them from their websites that you are going to be talking to. And when you call them, they will show you every Medicare option available to you in your area, including detailed information about which doctors, specialists, prescription drugs, hospitals that are covered with that plan, what co-pays you have to pay, and they will help you compare that plan to traditional Medicare and for you to make an informed decision. So call them at 539-205-2147 today. Don't delay, or go to askchapter.org/insider. We'll also put a description in this video. You can click on the link and fill out a short form and they'll reach out to you. And guys, these guys can save you money and they can help you avoid being one of the 90% of seniors that are in the wrong Medicare plan. But you have to call now because there's a short window. If you are signing up, you have a short window to do that. Or if you're already on a plan and you want to switch, your window may be even shorter. So call Chapter and let them help you figure out Medicare. A+ rating from the Better Business Bureau, tons of 5-star reviews online. These guys are the real deal. That is why in 15 years of doing this, we have not partnered with any Medicare advisory company until now, because these guys are here genuinely to make Medicare transparent and help seniors get in the right plan. And then finally, we have a newsletter to help you stay on top of all the news that is happening in and out of Congress that will affect your benefits, your Social Security, Medicare, Medicaid. We want to be the first to bring it to you. Go to this website and sign up, or go to our YouTube channel. There is a link at the top. Click on that form, put your email in, and we will keep you posted. So thank you for watching this. If you're turning 65, I hope that this has been helpful to you. If you like what you heard, hit the like button, hit the subscribe button. I'll see you in the next video.